Good afternoon and welcome to the Illawarra Shoalhaven Local Health District Annual Public Meeting, where we reflect on what's happened in the 2019-20 financial year. Firstly, I'd like to invite Jade Kennedy to deliver Welcome to Country. Jade.
Thank you, Dennis, and thank you everybody. As introduced, my name is Jade Kennedy and I'm a traditional custodian here in Illawarra and the South Coast. So it's always an absolute honour and privilege for me to be invited to welcome you fellas to country. See, for us it's one of our most significant and sacred customs. And I like to use these opportunities to share and in some ways educate the significance and sacredness of this custom. And in doing that, I like to share a number of concepts with you to say this is not just an opportunity for me or someone from our local community to stand up and blah, 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 welcome to country. That this is actually an opportunity for us all to reflect on our relationships with this place that we all share. And so we speak about country in terms of place and our intimate relationship with our place. So when we're welcoming you to our country, we're welcoming you to the relationship that we have with our place. We're welcoming you to those significant and sacred landmarks within our place. We're welcoming you to the specialness and the specialness of our relationship that we have with our place. Here in Illawarra we speak of Mount Kira and Mount Kembla. We speak of our 5 islands and our lake. We speak of the relationship that we have between the mountains and the sea. And we speak of these things in terms of our intimacy of relationship with these. This is what we're welcoming you to when we speak of country in that way. But we also speak in terms of kinship, because we're not only welcoming you to our place, we're also welcoming you to our kin. And through that welcoming in, we're welcoming you to the roles and responsibilities, the obligations that we have to our family and to the people that are connected to this place. So we're welcoming you to our people and our relationships with each other. We're also welcoming you to our culture. And through that way, what we're doing is we're acknowledging that culture is particular to place and people. And we welcome you to this country. We're welcoming you to what is the first of the first Australians, the first Aboriginal country impacted by invasion and colonisation, missionisation, institutionalisation. We're welcoming in all of you to a culture that has been influenced and impacted by this, but is still thriving and surviving through the particular place, its sacredness and significance, and the particular people that are in relationship and carry its story. Because that's what we're also welcoming you to. We're welcoming you to our journey. And our journey is that. It is the interrelated and the integrated stories that exist within this place, within this people, within this culture, since that time of creation. We call that connectedness, and this is what we're welcoming you to. We're welcoming you into the connectedness that we have with our place and our people and our way and our stories. And what we ask of you is that you acknowledge this welcome by reflecting on your connections to this landscape, your connections to the people of this place, your connections to its culture, your connections to these stories. This is how we can all be in relationship. This is the sacredness and significance of this custom. It's not just an opportunity for me to blah, blah, blah and say a few things. This is a true and real opportunity for us to start addressing this thing we call reconciliation. It's a true opportunity for us all to build an intimate relationship with the place in which we are living, or working, but the place that we are sharing. And so with that, you fellas, we say Yulanga, and we say that 3 times. That's our custom. We say Yulanga, Yulanga, Yulanga Labu, and that is welcome, welcome, welcome you to me. Welcome to the lands of Guri, to the lands of Biribiri, to the lands of Warrabinji Nandagari. That is welcome to the lands of the sea eagle. Welcome to the lands of the humpback whale. Welcome to the lands of the red-bellied black snake. And as we welcome you, we also acknowledge our elders. We acknowledge those of the past, we acknowledge those of the present, and we do acknowledge those of the future. For they hold our stories, they hold our traditions, they hold our dreams, and they hold our aspirations. And so with that, you fellas, Yulanga, we wish you peace on this journey. Thank you.
Jade, thank you. And I'd like to begin by acknowledging the traditional owners of the land on which we're meeting, and the elders past, present and emerging, and in particular those attending today's event. We are sort of on Skype. We have quite a few people who are dialing in, and I welcome all of them. We've asked for questions in relation to anything to do with the district, and we've had a couple, one from Anna Watson and one from the executive of the Shoalhaven Hospital, the auxiliary of the Shoalhaven Hospital, and I'll deal with each of them as we go through, and thank you for that. I'd first like to welcome online Mr. Ryan Park, the member for Kira, Miss Anna Watson, the member for Shellharbour, Mr. Lee Evans, the member for Heathcote, and Mr. Paul Scully, the member for Wollongong. I want to say something, come back to Shellharbour, which I'll talk about later, but at this point would like to talk about our MPs. In the 2 years, actually 5 years, with a slight hiccup, that we've been working towards a rebuilt Shellharbour, we've had fabulous discussions with the local MPs from Heathcote to Ulladulla, all 6 of them, and 3 from each of the major parties, 2 ministers, 2 shadow ministers. And each of them in that whole time completely put aside party considerations and committed to what it was we were trying to achieve, and lobbied the Minister for Health, the Honourable Brad Hazzard, in relation to this project. I have no doubt at all that without their help we would not have prevailed. To my mind, this was the political process as it should be, and all 6 should be congratulated for their contributions. I'd like to mention, also welcome today, Margot Mains, the Chief Executive, and her district executive leadership team, and staff and members of the public who are with us here or online. I'd also like to welcome my fellow board members and introduce them. Eve Bozak, Eve? Online. Alan Hudson, Alan. John Stubbs, John. Bill Lovegrove, online, and Rod McMahon. Rod, saw you up there. I'd like to thank all of the board members, past and present, who've worked tirelessly after the last 12 months. They bring a wealth of skills and experience, and I think are the most accomplished and committed board that it's been my privilege to work with. I wanted to say a little bit more about the board members who are due to retire in the next few months, having been on the board for their statutory maximum of 10 years. Gerard Sutton, former Vice-Chancellor of the University of Wollongong, among many other achievements, who has brought experience, local knowledge and a degree of wisdom to the board that has been absolutely outstanding. Professor Kathy Eager, who's the Director of the Australian Health Services Research Institute, has more knowledge of the health system, really, probably than anyone in the country. You may have seen recently she's been helping the Aged Care Royal Commission. She really has been a font of absolute knowledge. Bill Pratt, who's a physician at the Shoalhaven District Memorial Hospital. Bill has been able to take a global view of what we should do across the district and has again been invaluable. Marissa Mastriani, the Chair of the Finance and Workforce Performance Committee at the moment, a board member of the NRMA. Her day job is as Group Chief Executive of the University of Wollongong Global Enterprises. She's an outstanding manager and innovator, and her contribution to our discussions around governance, again, have been invaluable. Paul Knight, who is Chair of the Audit and Risk Committee, Chief Executive of the Illawarra Land Council, and has contributed in many ways, including in efforts to improve Indigenous health and for his financial contributions to the management of what's effectively an impossible financial situation. Roger Downs, Chair of the Planning and Innovation Committee, formerly managing partner of Kells. When I talked to Roger about joining the board, he said he's had no experience of health and he didn't know how he'd go, but he agreed to give it a go. He has a long history of helping of being on boards of outfits like Lifeline and so on, and of commitment to the community. Having decided that he had no experience in health, I asked him if he'd chair the planning committee, and he did. And he's brought a level of commitment, attention to detail and integrity to that process that's remarkable. The Deputy Chair, Jill Bohm. She's also Chair of the Healthcare Quality and Safety Committee and the Medical Appointments Advisory Committee. As if it's not enough that she's done an outstanding job in those roles, she's basically covered me, or in all sorts of circumstances, when I've fallen short, I haven't been available, and I couldn't have survived without her. Joy, thank you. From October until now, the district's been on a high level of activation for disaster and emergency responses. We saw the worst bushfires in this region for many decades, impacting many of our in the community and on the staff as well. I think there are some floods in the middle, and then in March, a once-in-a-century pandemic. Our local health district was required to respond in very short time frames to these unprecedented situations and combination of situations, while still assisting with bushfire recovery. And this is a response of which we can be very proud. Margot Mains and her team mounted a response as urgently as the crisis demanded, and as competently as could possibly be desired. The response to COVID of this district has been acknowledged by the Ministry as one of the best 2 or 3 in New South Wales. The New South Wales response has been acknowledged as the best in the country. I think the other 2 on that list only got in because they wanted to be polite. As well, when the Minister for Health wrote to the aged care sector outlining his views of an ideal response to this pandemic, he detailed exactly the measures that were in place in the Illawarra. Our primary task is to care for the people of the Illawarra, and in that Margot and her team have done a Herculean task and an outstanding job. About 3 years ago, we launched the new direction and strategic plan for the district, strategic directions for 2017 to 20. I updated you on the process 1 year into the delivery last year, and we'll do the same again today. We'll also hear about the Healthcare Services Plan for the next decade, which describes a vision for an integrated health system in the Illawarra Shoalhaven region, which supports people to stay healthy in their homes and in the communities. First, I'd like to welcome Margot Mains, our Chief Executive, to provide an overview of some of the key achievements of the past 12 months. Oh, good. I'm glad you're not Skyping in.
Thank you, Professor Dennis King, to our board members, to all my colleagues and to our local community joining us online this afternoon as we live stream our first annual public meeting. It would be fair to say this has been a year of many firsts. Today, as we take the opportunity to look back over the past 12 months and the accomplishments of the local health district, we can reflect with a great deal of pride and a true sense of achievement. First too, I would like to acknowledge the traditional owners and custodians of the land on which we're meeting today and pay my respects to elders past, present and emerging. Well, we've heard it said many times that it's been a challenging and an unprecedented year. And for the southernmost part of our district, it started at the end of last year with the devastating bushfires which decimated parts of the Shoalhaven, followed by damaging floods in an already ravaged area. From our emergency bushfire and our flood response, the district's focus quickly turned to COVID-19 pandemic. We immediately established an emergency operations centre and local and clinician-led task forces throughout the district. Then began the process of implementing extensive service change, staff changes, infrastructure developments to enable us to enhance our COVID preparation, but also to be able to support safe management of our patients and also to ensure that our staff were kept safe. Today we're going to walk through that COVID-19 journey with the launch of a video that captures those months and the essence of how this extraordinary time unfolded throughout our district, but more on that later. COVID-19 certainly presented many challenges for us all, but it also delivered us opportunities like we have never seen before. The district's advancements in teletechnology this year have been truly amazing. From more advanced online training to information videos and virtual consultations, we've hit the fast forward button in a terrific way. We've been able to significantly enhance our capability to ensure online specialist consultations, meaning patients didn't need to come from their homes for their follow-up appointments. Little did we contemplate at the beginning of this year that our staff could deliver so many clinics and so many consultations without the need for the patient to be physically in their rooms. We also fast-tracked the development of a virtual community care centre, which allowed us to remotely care for COVID-positive and at-risk people within the comfort of their own homes. We've learned the tremendous value of developing solid plans, but also enabling flexibility in the way we deliver our services. With a couple of examples, so within a matter of hours, pop-up testing clinics were established, which enabled hundreds of people to be swabbed. Within a matter of 4 to 5 days, a second intensive care unit was established at Wollongong Hospital. The SEED Staff Wellbeing Program at Milton Ulladulla Hospital was also developed during the bushfires, and it's an example of how something truly special can grow from devastation. That program supported staff to get through the tough times, and it's continued to deliver strength and resilience guidance for staff at Milton, and now has been expanded to other hospital sites. We've also made some inroads within our Aboriginal communities this year, including improvement to oral health services for families and the establishment of a partnership that aims to provide greater maternity care services that are safe and respectful of culture and spirituality. We're also incredibly proud to see the Bulli Hospital and Aged Care Centre open to patients in August, and the feedback that we have got has been amazing. The $50 million facility looks amazing, and it will certainly support our staff in providing excellent care for our older residents long into the future. Planning for our near $500 million development or redevelopment of Shoalhaven Hospital has now taken also a major step forward with the appointment of the project management team. Together with the board, the district strategic executive and the Shoalhaven team have long had a vision for the hospital that will see a creation of a hub for the Shoalhaven area, providing the majority of emergency, critical care and other services, whilst reducing the need for patients to travel to Wollongong and to Sydney. Then came the brilliant news in September that the Shellharbour Hospital redevelopment project would in fact be a greenfield site build, meaning a brand new facility will now be constructed on a greenfield site. But we'll hear more about that from Amy Haynes, our brilliant Director of Planning, on where to from here a little later. Other major works that we've also seen happen in the last 12 months was the completion of the new parking facilities at Shoalhaven, the start of major works at the redevelopment of the Wollongong Hospital Children's Ward, thanks to the generous and ongoing support of the Illawarra Community Foundation. We also reopened the refurbished birthing unit at Wollongong Hospital, giving local mums and their babies access to facilities that better support more modern ways and modern models of care for women during delivery. The district is incredibly proud of the significant enhancements to quality and safety, which have led to real benefits for the health outcomes of our patients. And I'd just like to use the example at Shoalhaven Hospital, who became the first in Australia to implement a specialised stroke assessment tool where time to treatment is crucial. We achieved also significant improvements in staff safety, including a 20% reduction in workplace injuries across all of our groups of staff and professions. And we at the same time reduced the need for nursing and midwifery overtime by 24%, which through those improved practices enhances staff safety even further. We launched the Emergency Department Transformation Program to improve patient outcomes and service performance. This program supports interventions across our 3 major emergency departments, and the first phase includes a new model for senior assessment. Mental health has been a major area of concern for us this year, with so many people being affected by the challenges that have surrounded us, whether it's been bushfires or COVID. It's an area that we will see significant growth in the coming years as we continue to deal with what is actually happening through COVID and post other impacts. We have been fortunate and been successful in obtaining additional services and dedicated teams that will enable us to reach our more vulnerable people even more than we ever have done before. We also this year implemented the Safe Spaces Initiative, which is a regional first, as part of the Towards Zero Suicides project, in support of the Shoalhaven, in support of the district's participation in the Illawarra Shoalhaven Suicide Prevention Collaborative. We've also been the most engaged with our community than we've ever been right now. For the first time this year, we've had a social media presence. And we've not only kept our community well informed, but we've also been able to use it to celebrate advancements and our achievement, and in particular, our people. Our Facebook page alone has been able to engage with more than 500,000 people since March, including locals and visitors. I think it's suffice to say that this year is a year we will never forget. We will long remember it. And while COVID-19 has changed the world and life as we know it, one thing that has remained constant in our world, in our local health district, is our truly amazing workforce. The agility and the resilience of our staff, coupled with an absolute robust dedication to keeping people safe and well, has been inspirational. I am delighted that some of our teams have actually been recognised for their work. Our Drug and Alcohol Service was a winner at the New South Wales Multicultural Health Awards for a project that saw language resources dedicated for communities from diverse backgrounds. They partnered with our Healthcare Interpreter Service and with our Multicultural Health Service to create a series of films in 16 languages on how to access alcohol and drug services. That project also last week won the Transforming Patient Experience Award at the Ministry of Health Awards. We also had 2 finalists in the New South Wales Excellence in Nursing and Midwifery Awards, and Wollongong's Emergency Department has been named Emergency Department of the Year by the College of Emergency Nursing. Our own Savour Awards have received more than 200 nominations celebrating staff and volunteers whose colleagues feel that they've done something outstanding, something truly exceptional this year. I must say also, though, that our staff have felt incredibly supported by their community, by the Illawarra and Shoalhaven communities this year, more than ever. From restaurants who supplied hot meals to staff during lockdown, through donations of masks and handmade scrubs by local sewing groups, we say thank you. I'd also like to take the time to thank the board chair, Professor Dennis King, and all of our board for your amazing, strong leadership, your vision, and your passion and your commitment for our district. It has been absolutely wonderful to work with you. I feel really, really sad for those board members who are leaving us, because your expertise, your dedication, your leadership, your wisdom and your experience will be hugely missed. Thank you. In particular, I'd like to acknowledge Dennis and his strength of leadership and the support that he has given me. It is through that leadership, and alongside with Jill as Deputy Chair, that we have been supported to lead really strong changes for the better in people in our district. And the support that you have given management, clinical leadership and clinicians throughout your time has been absolutely amazing. Thank you, thank you, thank you. We also would like to thank the community for your ongoing support through the COVID measures. It's not been an easy time, and it will continue to be challenging. But thank you for responding to the need for physical distancing, for the need to wear masks, for the fact that we've limited visiting times, and the fact that you've been heeding the call to get COVID tests. All of these measures have enabled us to be in the strongest position for our fight against COVID, however long it lasts. Together, we will all collectively work to navigate the year ahead of us, but can I just say thank you to you all. It's a pleasure to serve you as Chief Executive. Thank you.
Margaret, thank you very much. In November 2017, the board was delighted to launch the Strategic Directions Plan, which reflected its vision for the district, and a lot of that's come to fruition in the last 3 years. We hope to set out a clear path for the district with a focus on serving the community, planning for the future and better engaging our consumers. The plan was designed to build further upon the achievements by the local health district since its establishment about 9 years ago, including growth and development of services, the significant investment in expanding in hospitals and community facilities, and generally meeting the healthcare needs. We developed 4 strategic priorities, and I'd like to highlight some of the key achievements within each priority during the final year of the plan. The first related to the provision of health care, health programs and health services. And the key outcome in this area related to partnering with our consumers, evidence-based care decisions, improved access to community services, and improvements that we hoped would help close the health and life expectancy gap for Aboriginal and Torres Strait Islander people. Consumer engagement was the key focus of ours this financial year, with the Clinical Governance Unit formally recruiting 3 consumers to the Governance Council and the district-wide partnering with Consumers Committee. Their insights and contribution have been invaluable in shaping the way we do things. We supported a range of online tools to support implementation of the Partnering with Consumers framework. Eliminating the gap in health outcomes between Aboriginal and non-Aboriginal people remains a priority for the district. And for me personally, I acknowledge that our partners currently watching this event. Developing our Aboriginal workforce has been a focus this year. The Aboriginal Employment Drive, implemented in the second half of 2019, created positive engagements with services around strategies to recruit and support Aboriginal staff. Some of the initiatives including funding approved for 10 school-based apprenticeship and traineeships across the district, recruitment of an Aboriginal population health trainee, funding for a dedicated Aboriginal staff member to enrol in the University of Tasmania postgraduate degree in health service redesign, and funding for a dedicated Aboriginal health worker in palliative care. These things are great progress, but I acknowledge that we can and we must do better. Many of you may have seen the Productivity Commission, which is just a report just released, Overcoming Indigenous Disadvantage for 2020. Let me quote Maggie Walter. She's the inaugural Pro Vice-Chancellor for Aboriginal Research at the University of Tasmania. She made the point that behavioural change only comes when people have skin in the game, through some measure of accountability or responsibility for the outcomes of their actions. She correctly states that there is no shortage of goodwill in departments, but that is not enough. We must have reasons to move beyond what we are doing now and consider and include evaluation in a more comprehensive sense. To quote Einstein, he defines stupidity as doing the same thing over and over again and expecting a different result. And to a large degree, we need to change what we've been doing. The implementation timeline from the Productivity Commission indicated that within the first 6 months, and I quote, agencies begin to develop capability and data for evaluation, including measures to strengthen and support capability for Aboriginal and Torres Strait Islander people, organisations and communities. And it's a process that we are planning to start on quite specifically within the next few weeks. We've underachieved in this area for too many years. It's time to move ahead. The next strategy was engaging a high-performing workforce. Our workforce is, just like the community, have been through a great deal this year: bushfires, droughts, floods and a pandemic. On behalf of the board, I would like to thank you all again for your commitment, your relentless hard work and strength. As I've already mentioned, what's really amazed me this year is how quickly everyone rallied around to support each other and the community, and Margot has detailed some of those things. It was quite extraordinary what we saw. That said, we needed to continue business as usual. It always happens in health. Some of the projects and strategies were able to be implemented, and some born out specifically out of the devastation. The BFAR stroke assessment pathway, a chest injury protocol, a coping with pain program for Arabic speaking and refugee women, the staff wellness program specifically created during the bushfires and now adopted by several of our sites, and a number of safety transformation programs. The third strategy is around innovation, agility and learning for continuous improvement. And Margot has also already detailed some of the practical effects and some of the awards and some of the compliments that have been garnered as a result of these activities. Our workforce has quickly adapted to telehealth to keep our community as safe as possible during the pandemic. There are over 600 Illawarra Shoalhaven clinicians delivering healthcare via telehealth modalities, with nearly 200,000 occasions of services through the financial year, and this was to a large degree from a standing start. Future strategies include the Tele-Stroke project, virtual care clinics and mental health virtual uplift project, and in our planning for the future we are incorporating these sorts of new models of care It is as the way of the future in many cases. Finally, efficient, effective, sustainable financial operations. I mentioned previously that health's impossible. Well, perhaps not impossible, but it's not a great financial model. Unlimited demand, unlimited expectations and limited budget. No organisation would structure itself like that if it had any choice. But as an organisation, we have an obligation to deliver financially responsible, sustainable and safe healthcare services. And it's imperative that we spend every taxpayer dollar as effectively as possible. This is not just about saving money. We always spend everything we can get our hands on. It's about opportunity cost. Every time we spend $1 on something that isn't effective, it's $1 we don't have for something that is. And that is the reason behind a lot of the things that we do. We need to target our limited funds. This year we've been able to adapt quickly and change the way we do things and what we focus on. We were fortunate to have some extremely generous donors during the thick of things. One in particular was the donation of $250,000, including 9 ventilators, from Tim Berry at Tibra Capital Fund, and we very much appreciate that at a time when we needed it most. Sustainability of our services also include ensuring our facilities are designed and built to support first-class healthcare. The district is not immune to the financial challenges that we're facing now, and we need to allocate funds in a way that creates the most value for the people we're here to serve. We have started detailed planning process for the redevelopment of Shoalhaven Hospital at a cost of $450 million, and hope that construction will start soon. You may recall in 2019 the Commonwealth Government committed $128 million to the development of Shell Harbour and indicated support for a greenfield site. As I'm sure you know, on the 8th of September, the Premier, Gladys Berejiklian, committed a total of $720 million to this project, including a relocation of the hospital to a far more appropriate and accessible greenfield site than the current hospital. The combined contribution will allow us to develop a facility which will improve the quality of healthcare for the 450,000 people of the Illawarra and Shoalhaven region. We'll be able to close a major site which has long been unfit for purpose, and to network and co-locate related services in the future. Appropriately now, I'd like to ask Amy Haynes, our Director of Planning, Information and Performance, to further explain the Healthcare Services Plan and the planning work occurring around some of these new buildings. Amy? Yeah.
Good afternoon, everyone. I'm really pleased to be here. Before I start, I'd like to acknowledge the Dharawal and Yuin people as the traditional custodians of the land in the Illawarra and Shoalhaven regions, and pay my respects to elders past, present and emerging, and to Aboriginal people here and in the online audience as well. And along with the NAIDOC theme for this year, I'd like to reflect on the fact that under all of ISLAD's hospitals and services, under the new hospitals we'll be building in the future, this land was, always will be, Aboriginal land. Today I'm going to share with you an update on our healthcare services plan, how we're building in those strategic directions into our clinical services and into our new hospital developments. So I'll start by briefly talking about our healthcare services plan, which was endorsed by our board last year. This is Illawarra Shoalhaven LHD's peak strategy document, and it really describes what we're trying to do over the next 10 years. And it's about change. It's about the directions we want to move in, and there are some big shifts that we're working towards delivering over the next 10 years. To sum up briefly, in Focus Area A, promote, protect and maintain the health of the community. As a local health district, we've traditionally thought of our main role as being about providing care for the sick and injured, but over the next 10 years we're working towards strengthening our role in keeping the community healthy, in supporting people to stay well, and in intervening early to prevent the progression of chronic disease. In Focus Area B, strengthen care in the community. We're working to move care where we can out of hospitals and into community-based settings and into people's homes. and virtual care technology will play an increasingly important role there in the coming years. In Focus Area C, address the cultural and health needs of Aboriginal people. We are strongly committed as a district to working in partnership with First Nations people in our region to improve the care that we provide to them and to improve our cultural competence at all levels of our organisation. And Dennis and Margot have spoken about this too. And in Focus Area D, commit to high value care. High value care is about moving in focus from a focus on the volume of care we provide to the value that that care adds. For us, this means focusing on evidence-based care, measuring outcomes, and investing in care that improves health outcomes. And Focus Area E is strengthen partnerships and engagement. Our partnerships with general practice, with the primary health network, with private providers, other government agencies and NGOs are a vital part of our future direction over the next 10 years. I want to talk briefly about some highlights in a couple of key areas of our healthcare services plan. In Focus Area A, firstly, the first 2,000 days. As many of you will know, there is a strong evidence base that shows that the experience of a child in the first 2,000 days of their life has an enduring effect on the trajectory of their whole life. New South Wales Health has released a first 2,000 days framework, and our district has been developing its local implementation approach to that. We have some very strong strategic partnerships in this area with other agencies and some great cross-service projects underway, and this is an area of continued focus for us in the coming year. The other important area that we're building up is our response to climate change. ISLA is already very active in responding to the impacts of climate change, for example, the bushfire emergency that we had over last summer. And we know that not only will there be increasing numbers of climate-related emergencies in coming years, but also increased periods of extreme heat with significant impacts on the health of our communities. But we're also now turning our attention to our own carbon footprint as a district. We're looking at other exemplar health systems for what we can learn from them, and we're looking to capitalise on our new capital developments and hospital builds to meaningfully impact our carbon emissions as a district into the future. And in Focus Area B, shifting care from hospitals into the community is something that our patients want, and it's something we're actively working towards with a number of exciting programs. The most notable development, as Dennis and Margot pointed out, was over the last 12 months has been the advent of our first virtual community care centre, which started with COVID patients, but now we're expanding that to encompass chronic disease models of care. There's also a lot of great work happening in partnership with general practice. We're also working on pathways for patients with chronic disease and some innovative commissioning approaches to try to bring together the various parts of the health system into a coordinated approach. But probably one of the most important things is that it's been working on to bring the healthcare services plan to life in our clinical services is comprehensive district-wide network planning. Service by service, we've been doing population-based planning to determine the future configuration of each clinical service. Population-based planning is about understanding the profile of the population and their needs and shaping our future services around this. For each clinical service, we've been looking at things like the age structure of the population. As you can see in the graph there, with the red part of each bar is the future population to 2030 and the change, which is growing strongly in the older age groups. The other big driver of health need and health service demand is the level of disadvantage in the community. In the Illawarra Shoalhaven, we have some of the most disadvantaged areas in the state. You can see them there in the dark blue areas of the map. And just to talk a little bit more about how disadvantage influences health demand. This is a page out of a health needs assessment that we undertook. It's for one of the LGAs in our district, and it breaks up the LGA into sub-areas and shows how each area is faring on a number of social indicators on the left, like education, unemployment and housing, and health indicators on the right, things like risk factors for disease, chronic disease and disability. The darkest red colour denotes the highest level of disadvantage relative to the state average. And what the data shows is that there is a very strong correlation between the social and health advantage or disadvantage. And for us as a health service provider, it shows that we need to be playing a role with other agencies in mitigating the complex social underpinnings of poor health status. And I can tell you, this kind of nuanced understanding of population and how it's driving our current and future service demand has directly influenced the planning of our clinical services. And I'll talk about some of those in our hospital developments in a moment. I want to talk for a moment about our service network, because this is a really important concept for understanding how our services are placed across the district and how our services are provided in each of our facilities. Illawarra Shoalhaven LHD is one service network delivered across many sites. Our individual clinical services operate in this way across sites, for example, district-wide renal services or cancer services, and this gives us important quality and safety gains. Our hospitals also operate in a network, and every facility plays a role in that network. Most of our facilities, both hospital and community, serve their local communities, but also have a more specialised role. One example is Wollongong Hospital, which is Islad's principal tertiary referral hospital and provides the most specialised and complex care for residents for our whole district. A different but equally important example is Bulli Hospital, an aged care centre pictured here on the slide, which provides specialist services in aged care. These two hospitals, although completely different, work closely together in the network, with Bulli taking older patients from Wollongong into its specialist service model, freeing up Wollongong to play its tertiary role. And this is how we're planning the inclusions for our new hospitals too, based on the planned service networks of all of our individual clinical services. So far over the last year, the services on this slide have undertaken a comprehensive district-wide network planning process and have come up with their future service configuration across the district. You can see some pictures there of the planning workshops some of those services ran, some of them obviously pre-COVID with everyone in the room, and then one at the bottom left, online during COVID. And we'll be continuing with our district-wide network planning over the coming year. And it's from those future service networks of our major clinical services that we've shaped the role and scope of our new facilities. It's been nearly 2 months since our Shellharbour Greenfield funding announcement, but I'm still amazed contemplating the figure on this slide. This is the combined total of our Shoalhaven and Shellharbour funding commitments. As a district, it puts us in the big leagues, relatively speaking, in New South Wales when it comes to capital investment over the next 5 years. It's an unprecedented opportunity for the Illawarra and Shoalhaven regions. And we're not taking that opportunity lightly. We know we need to harness the potential of the big changes happening in health in our new facilities. Technology across the clinical and corporate areas of healthcare is already driving big changes, with virtual care and telehealth, wearable devices which enable us all to monitor our own health, widespread use of advanced analytics, and automation across a number of corporate functions, to name but a few big opportunities. And we'll be designing our new hospitals differently to support this. One example is the command centre in the photo at the top left on this slide, which is in effect a control room for all of these automated functions. The other enormous opportunity we have with our new facilities is to build sustainable buildings which will maximise resource efficiency and help the district minimise its carbon footprint into the future. And we want to build facilities which are healing in themselves, that are connected to their place and bring the outside in. We've heard this aspiration consistently from the community and from our staff as well. We're very serious about maximising the potential of our new hospitals for both digital health and sustainability, and we're already going over and above standard processes right now in our early planning to work with experts in these fields. The new Shoalhaven Hospital. We're very excited about the new Shoalhaven Hospital. This will be a really significant expansion of the current hospital, both in terms of size and scope, and it will make a big difference to the community because they'll be able to access the majority of health services locally. The expansion of Shoalhaven is a great example of population-based planning in action. The Shoalhaven region has a significantly aged and population, and there's a high level of disadvantage as well, which has led to strongly increased demand for services in recent years, and that will continue into the future. And as a result, several of the LHD's service networks will be increasing their role in the Shoalhaven Hospital, including notably increased emergency and elective surgery capacity, with the introduction of a new surgical specialty of vascular surgery, which is a direct response to the health need in the population. Expanded medical and aged care bed base, introduction of cardiology as a standalone specialty, including a cath lab. And this is a response to the high burden of cardiovascular disease in the Shoalhaven. The introduction for the first time in the Shoalhaven of acute mental health beds, which will make a big difference in the community. Increased support services, including ICU, ED, medical imaging, palliative care and rehabilitation services, and of course, enhanced outpatient capacity so that we can start to move care out of inpatient settings where possible. And in terms of where we're up to with Shoalhaven, as Margot said, we have project managers appointed and we're working hard on the planning. The clinical services plan is for Shoalhaven is currently with the Ministry of Health, and we expect sign off for that in the next few weeks. We've been doing a detailed models of care planning process with our clinical staff and with consumer representatives. And I want to make a note, I suppose, about the really strong consumer representation and input we've had in the Shoalhaven project so far, and that will absolutely continue, and also in Shellharbour too. We've had consumers in the model of care discussions, which are about the day-to-day care that's provided in the hospital, but also we have consumers right up at the highest level of the project governance, and they have contributed enormously already. So this is a great advance for us. And next, we're moving on to master planning very soon, and that will include a comprehensive community consultation process. And the new Shellharbour Hospital. The opportunity to build the new Shellharbour Hospital on a greenfield site enables us to cater for the growing need of the community, but also to achieve some really important things in terms of the district service network. This hospital is going to play a very important district-wide role in a few specialty areas. The first one is elective surgery, particularly for elective orthopaedics and ophthalmology. We're going to build an elective joint centre for the district, which will be a patient-centred centre of expertise for hip, knee and knee surgery. That'll have specialised facilities and a specialised staffing model as well. The other specialty role for Shellharbour will be in mental health. Mental health models of care and facility design have evolved rapidly over the last few years, and we're very much looking forward to being able to build modern, recovery-focused facilities for consumers who need inpatient care. And in terms of where we're up to with Shellharbour, as you know, we had the announcement. Health Infrastructure now is leading the site evaluation process. And that will be resolved over the next few months. And we also, right now, are working on detailed clinical services planning. We'll be submitting our plan to the Ministry of Health over the next few months as well. So the next steps are the confirmation of the site and the confirmation of the clinical scope, and we'll go from there. Thank you very much, everyone.
Amy, thank you very much. It's becoming an exciting time here in the district, I think, and hopefully for the community, with what we're hoping to be able to deliver over the next few years, and with planning for decades, as far ahead as one reasonably can in such a changing environment. I'd like to thank, firstly, we did ask for some questions, and we have a couple from Anna Watson, one relating to investigation of people who suffer long-term brain damage from domestic violence. We have protocols in place, and we'll, rather than go through all of that now, we'll communicate directly with Anna. The other was from the Shellharbour Auxiliary, who are wondering what's happening with Shellharbour. I think that's a legitimate question, bearing in mind the first plan was some 5 years ago and became a hole in the ground and then nothing much. All I can say is that what we have now has been what we have wanted all along, for reasons that are valid, and I think we took the view that if we had to wait another couple of years for the right solution, it was better than proceeding with what we thought was the wrong solution. and then having to deal with many more problems 10 years hence. But again, we shall be communicating directly with the auxiliary around that. You've seen some impressive stuff today and heard a lot of good things, and particularly in the way that the district functioned as a team during a very difficult year. Every team needs a leader. The really significant thing about that is that we had the right one at the right time. Margot's commitment has been extraordinary, and I think pretty much all the credit for what's happened goes to her, and I want to thank you on behalf of the board and everyone for all that you've done. On behalf of the board, the Chief Executive and her staff, I thank you all for joining us today and wish you well for the festive season, and let us all hope 2021's a bit better. Thank you. Sorry, there's a video.
Life is changing in Australia as it is changing all around the world. Life is going to continue to change as we deal with the global coronavirus.
Please know how serious this is.
March 2020, and the world as we know it is radically changing. Locally, the threat of COVID-19 is real, and so begins a response and readiness regime by the local health district like no other. With positive cases increasing here and across New South Wales, the district had a strong and clear focus.
Being nimble is the key, and we need to adjust rapidly to what may be a significant surge in people presenting to our emergency departments, needing beds and needing increased ICU capacity, and that is what we are working on every day.
By the end of the month, hospital visiting hours were restricted, COVID screening and temperature testing at sites implemented, outpatient consultations turned virtual, and non-urgent elective surgery was stopped.
This will free up staff that are usually working in or supporting in theatres and delivery to enable them to have time to train to develop intensive care skills to enable us to achieve double the capacity that we currently have.
Some of which already had intensive care nursing skills, others had none, and they have been and are still going through an intense training program to ensure that they are ready and able to look after intensive care patients safely.
We've identified 2 other areas that can be opened up in a stepwise fashion in order to deal with further people that may require critical care services.
We are continuing to run our mental health services. We are continuing to provide acute rehab and subacute inpatient services. We are continuing to provide all of our community services.
The local community rallied to support staff and hospitals, including the Tibra Capital Foundation, donating $250,000 for equipment.
At this point, we're all, I think, pretty glad to be healthy and employed, but to be able to contribute like this and to support the hospital really gives us meaning in an otherwise pretty helpless time.
Adding 9 ventilators to our fleet has enabled us to not only open up our second ICU, but now we can move forward to opening up our third ICU with the knowledge that we have ventilators for the beds for the patients that need it.
By mid-April, more than 7,200 Illawarra Shoalhaven residents had been tested for COVID, including at dedicated screening facilities established at Wollongong, Shellharbour and Shoalhaven hospitals.
A lot of our confirmed cases have actually come from overseas travel, and that's died off in the last few weeks, the number of cases, and part of that's because of the public health measures that we've implemented, and that includes social distancing, really good hand hygiene, and also intensive contact tracing and case identification.
We are increasing testing and screening more people than ever in our community. Our service planning PPE logistics, our workforce redeployment, and our ICU capacity building very much continues, as we know the journey in the pandemic response has only just started.
Local information and advice was stepped up, and just weeks after being established, the district's Facebook page saw a community reach of more than 120,000 people.
Ciao, io mi chiamo John Paul Troiani.
Guten Tag, mein Name ist Dr. Alexia Pape und ich bin heute hier.
您好，我是 Dr. Jenny Chen， 卧龙岗医院的陈医师。
By May, COVID tests in Islett had almost doubled. Community restrictions were being eased, elective surgery was being reinstated, and work continued to build intensive care capacity and COVID wards.
That included going from a 18-bed capacity to now a 46-bed capacity with the development of ICU 2, which we're now standing in. ICU 2 is a non-COVID ICU. ICU 3 is a 20-bed unit, which currently is set up to a point where it is able to be deployed and set up to take patients into it. The process of mobilising to expand our capacity has been a huge feat.
The staff can be immensely proud of all the work that they've put in to make this a safe place for patients, and also all the hard work that's been put in to make this place a safe for the staff to work in.
Being able to be there for our patients, we are their connection to the outside world while they are here on the ward or in the hospital. So we looked at different ways of communicating with our patients, making sure that we addressed all their needs.
We've now been ramping up our surgery to try and get back to our usual level of elective surgery. If we need to have a surge capacity, we will reduce our elective surgery back to just essential surgery. That frees up space within the hospital to create an additional intensive care unit.
This hospital has provided for the community a facility that really was good before, but now will be better for COVID, but also better into the future. We now can look after infectious style patients much better than we could before.
By the end of May, funding for additional positions in allied health and to boost mental health services was announced.
For Islett, our share of this funding means we can now focus on 5 key areas: inclusion to the statewide mental health access line, an expansion of the frequent attenders ambulance program, the development of more diversional activities for our inpatients, more clinical staff for our community sites with a focus particularly on vulnerable people, and lastly, the expansion of virtual mental health services. All of us are balancing a return to business as usual with maintaining our COVID readiness. I want to thank staff at Shoalhaven Hospital who are now back at 100% of their normal surgical caseload. This is an amazing effort by all involved. Well done.
By mid-year, the organisation was able to harness the many opportunities provided by COVID to try new models of care, including the use of technology and the fast-tracked implementation of virtual community care.
Our district has joined forces with the Southern LHD and Coordinator to pilot a program that will enable clinical teams to develop tailored patient care across a large geographic boundary.
Thanks for joining us. There are 5,696 cases of coronavirus in Victoria. That's 363 new cases.
So everybody will be a little bit anxious at the moment, seeing what's happening in Victoria. What we know at the moment is that there are a few cases down there and they're sort of ramping up over the last week. There are a lot of unknowns ahead of us. However, the truth is that we're far better prepared than we were 3 months ago when we first faced this.
Staff in our public health team are assisting their Victorian counterparts with contact tracing, but also now confirming our rapid response plans should community transmission cross the border.
There's a clear and present danger from COVID. It hasn't gone away. It's clearly evident from Victoria that a small number of cases can turn into a large number of cases quickly. But if that does happen, people should know that the hospitals are well prepared.
With new outbreaks appearing on the outskirts of the local health district by August and the heartbreaking devastation seen in aged care facilities both in Victoria and Sydney, even more attention was placed on the district's support of local residential aged care facilities.
We know that just one case in an aged care facility can lead to disastrous and tragic consequences. It's for this reason that the local health district is taking the lead on bringing together every aged care provider in this region to work collaboratively to strengthen prevention and preparedness.
Even though each of the more than 40 homes in this region are managing their own affairs, in an emergency, it will be our relationship with our local public hospitals and public health services that will matter most.
It's unique that we're seeing this collaboration, but it's something that I think we will continue to do post-COVID. It is a strength of the Illawarra and a strength of the openness that we are to share these plans and be ready.
September and October are slowly seeing a return to life as we know it, but for the local health district, work continues.
It's important that we keep these efforts up and that we work hard to maintain our current level of awareness and responsiveness.
For many, it's been an especially tough time. Drought, bushfires, floods and COVID continually testing strength and resilience, particularly in the southern parts of our health district.
Because for a lot of us, it sort of feels like this year's just been one long crisis. We set up the wellness program for staff, a supportive program to give staff the opportunity to learn the various skills and coping mechanisms that serves them not only through crises like the bushfire emergency or the current COVID emergencies, but the normal day-to-day stress.
So I was actually on shift during the fires and felt quite stressed. As you would imagine, I put on the responsibility hat and did what I did to the best of my ability, but post-fires, actually the cracks started showing in my home environment at work. Being part of this program, it's changed my leadership, but it's also changed me as a mother in the home, as a partner to my husband, and how to support my colleagues.
We would just like to give our heartfelt thanks to the hard work, the dedication and the compassion of all our staff, regardless of what classification they are within the organisation. We came together as a team. We will move on through this period of COVID as a team, and we will be able to achieve amazing things like we already have achieved.
What we've learned both personally and professionally, how we've managed and why we keep coming back each day should motivate every single one of us. We should all embrace a renewed sense of hope as we reflect with pride on what's been achieved in the face of adversity.
Finally, as we head toward a COVID Christmas, take some time to reflect on the year that was.
Remember, stay vigilant, keep distance, wash your hands, and if necessary, get tested.
Thank you. Margaret's going to say a few words, but I did want to make the point that it's always been important to communicate in health, but never as important as this year, at every level and in every way. And I think our communications team's done a wonderful job this year. And we've done a lot of positive comment about how the communications to our community have been conducted this year, and I want to thank all of you. Margot, to finish. Thank you.
Well, I wasn't going to speak, but that was like a rapid trip down memory lane for the last 12 months, which when you actually looked at what actually happened is phenomenal. It's overwhelming, but I just feel utter pride. It's just an emotional, wonderful feeling, because what we saw there is people pulling together, giving of their best, absolutely committed to their community, absolutely committed to each other and each other's safety. And I cannot thank people for their leadership, whether it was the strategic exec and core exec, all of our clinical leaders, the leaders of our task forces, the hubs and the services, to all our staff, to all our colleagues. You're just absolutely amazing. We couldn't have done it without you, and I know we are in really good stead for moving forward together on the many wonderful and exciting challenges we've got ahead. So thank you to you all and to the public health team. Because what we also learned of the essence of the success of the management of COVID is around testing, is around contact tracing, and we were in an incredibly strong position. And to all our partners that work together. Can I thank Angela and Angela for all your organisation as well? These do not go without a lot of hard work. It's pretty simple. We can turn up, and they've done all the hard work that's made it happen, so thank you to you both. To Amy, what a brilliant presentation. You always present the future in such an amazing way, in a professional way, so thank you, Amy. It's wonderful having you as our lead of our planning, working with Caroline. Thank you. And I also would like to reflect on Anita and her team. Anita works with me every day, and her team have really led amazingly strong communications, always, but even grown above and beyond expectations this year. Wait for next year. But thank you and congratulations to your team. You don't go anywhere in life and leadership without fantastic leadership and support, and certainly I would just finally like to recognise our board. To Dennis in particular, your leadership has enabled me and my team and our team and the whole organisation, alongside with Jill, our Deputy Chair, and also the full board to achieve amazing things. So thank you, thank you, thank you.
What can I say? An interesting year, an excellent year. Thank you very much for attending here and online, and we look forward to seeing you next year. Thank you.